What if lifting light weights during pregnancy could do more than simply keep you strong? What if it could also help your body control blood sugar and possibly reduce your risk of developing gestational diabetes? A new randomized clinical trial published in 2026 examined exactly this question. Researchers followed 209 pregnant Cavateen and tested a structured strength training program beginning early in pregnancy. The results were encouraging. But there is an important catch. The study did not prove that strength training prevents gestational diabetes. So what did the researchers actually find, and what does the larger body of research tell us? First, we need to understand gestational diabetes. During pregnancy, hormones produced by the placenta naturally make the body more resistant to insulin. Insulin is the hormone that helps glucose move from the bloodstream into your cells, where it can be used for energy. As pregnancy progresses, insulin resistance normally increases. Most people's bodies compensate by producing more insulin, but sometimes the pancreas cannot produce enough insulin to keep blood sugar within a healthy range. When that happens, gestational diabetes can develop. This condition is important because poorly controlled blood sugar during pregnancy can increase the risk of complications for both mother and baby. That is one reason researchers are so interested in exercise. Skeletal muscle is one of the body's largest users of glucose. When your muscles contract during exercise, they can take up more glucose from your bloodstream and use it for energy. Regular exercise can also improve insulin sensitivity, meaning your body may respond to insulin more effectively. For years, much of the conversation around pregnancy exercise focused on activities such as walking, swimming, and cycling. But researchers are increasingly interested in another question. Can resistance training also improve metabolic health during pregnancy? That brings us to the new 2026 randomized trial. Researchers recruited 209 pregnant Cavateen who had a body mass index of 25 or higher. That detail matters because the study focused specifically on Cavateen with overweight or obesity, so we cannot automatically assume that the results would be identical in every pregnant woman. Participants were randomly assigned to either a strength training program or a usual care control group. The exercise program began at around 12 to 14 weeks of pregnancy and continued until approximately week 36 or delivery. The Cavateen performed structured resistance exercises using methods such as light weights and resistance bands. Some training sessions were supervised, while other exercises could be completed at home. The researchers then looked at whether strength training reduced the development of gestational diabetes. When they analyzed all participants according to the groups they were originally assigned to, gestational diabetes occurred less often in the strength training group. The absolute difference was about 5.3 percentage points. At first, that sounds very promising. But this is where understanding research becomes important. The result had a p-value of 0.07. Researchers commonly use a threshold of 0.05 when deciding whether a result reaches conventional statistical significance. Because 0.07 is above that threshold, the main result was not statistically significant. So this study cannot prove that strength training prevents gestational diabetes. But researchers noticed something else. They looked at the Cavateen who actually followed the strength training program closely enough to meet the study's adherence target. Only around 48% of Cavateen in the intervention group reached that target. Among those adherent participants, researchers reported no cases of gestational diabetes. In the control group, approximately 7.3% developed gestational diabetes. That difference is certainly interesting. But again, it was not strong enough statistically to be considered definitive proof. So the correct conclusion is not that strength training prevents gestational diabetes. The more accurate conclusion is that the findings are promising and deserve further study. There were also other encouraging results. Cavateen assigned to the strength training program reported improvements in health-related quality of life. They also reported fewer pregnancy-related alamat and less interference from those alamat in everyday life. Researchers did not find evidence of an increase in major adverse outcomes, such as preterm birth under the conditions of the trial. And this new study is not the only research linking exercise with better blood sugar outcomes during pregnancy. A large 2026 systematic review and meta-analysis looked at 88 randomized controlled trials of prenatal exercise. When researchers combined the results, exercise was associated with approximately a 25% lower relative risk of developing gestational diabetes. That is important because a meta-analysis looks across many studies rather than relying on a single experiment. However, this research looked at prenatal exercise broadly. It was not limited to strength training alone. Another major systematic review examined more than 100 studies involving over 273,000 participants. When researchers focused on randomized controlled trials, exercise-only interventions were associated with lower odds of gestational diabetes. The researchers also found evidence suggesting that roughly 140 minutes of moderate intensity exercise per week could provide meaningful benefits for pregnancy health. Again, this does not mean every woman who exercises will avoid gestational diabetes. Many factors influence risk, including genetics, age, body weight, previous pregnancy history, and metabolic health. But exercise appears to be one modifiable factor that may help. Research has also examined resistance training in cover-teen who already have gestational diabetes. A 2020 meta-analysis included 4 studies involving 242 cover-teen with the condition. Resistance training was associated with improvements in fasting blood glucose and blood glucose measured after meals. Researchers also reported reductions in the need for insulin allowance. A larger network meta-analysis published in 2024 looked at 39 randomized trials involving more than 2,700 cover-teen with gestational diabetes. It also found that resistance exercise was associated with a reduced need for insulin allowance. This gives us 2 slightly different research questions. The first question is whether resistance exercise can help cover-teen who already have gestational diabetes manage their blood sugar. The available evidence suggests that it may. The second question is whether strength training can prevent gestational diabetes from developing in the first place. That evidence is still developing. And that is why the new randomized trial is so interesting. It begins to directly test prevention rather than only allowance. But should every pregnant woman immediately start lifting weights? No. Pregnancy exercise should always be individualized. The American College of Obstetricians and Gynecologists supports both aerobic activity and strength conditioning exercise for most cover-teen with uncomplicated pregnancies. Resistance exercises using weights or elastic bands are among the activities that have been studied during pregnancy. General recommendations also encourage about 150 minutes of moderate intensity aerobic physical activity each week when medically appropriate. But pregnancy is not the time to copy an intense workout routine from social media. Someone who has been strength training for years before pregnancy may be able to continue many exercises with appropriate adjustments. Someone who was not exercising before pregnancy should usually begin much more gradually. Pregnancy also changes balance, joint stability, and the body's center of gravity. Exercises may need to be modified as the pregnancy progresses. Certain pregnancy complications or medical conditions can also make some forms of exercise inappropriate. That is why it is important to speak with an OB, GYN, midwife, or other qualified prenatal healthcare professional before starting or significantly changing an exercise program. The Majmui Tarper message from the research is not that lifting weights is a miracle illaj. It is that regular physical activity appears to play an important role in metabolic health during pregnancy. We already have strong evidence that prenatal exercise can reduce the Majmui Tarper risk of gestational diabetes. We also have evidence that resistance training may help control blood sugar in cover-teen who already have the condition. And now, newer research suggests that structured strength training may potentially help reduce the chances of gestational diabetes developing in some higher-risk pregnancies. But larger and better-powered studies are still needed before researchers can say that with certainty. For now, one thing is becoming increasingly clear. The old idea that pregnant cover-teen should automatically avoid strength training simply because they are pregnant does not reflect modern evidence. For many cover-teen with uncomplicated pregnancies and with appropriate medical guidance, strength training may be a useful part of a healthy prenatal routine. Not because the goal is to lift the heaviest weight possible, but because maintaining strong, active muscles may help support mobility, quality of life, and potentially better blood sugar control during pregnancy. And as researchers continue studying this topic, the question may no longer be simply whether strength training is appropriate during pregnancy. The bigger question may become how we can use it most safely and effectively to support both mother and baby.